That was appropriate.
Okay, but why not? I mean, with the pain, with the gallbladectomy.
Okay, I can't make that explanation, but what you've told me so far, they were doing the most appropriate stuff. Okay.
Okay. Have a good night, and thanks for some good information.
Okay.
Have a good night.
You too.
Hello, you're live.
Yes, I'd like to ask the doctor a medical question.
What's your first name?
My first name is Neil. I'd like to ask him what he recommends is the best treatment or possible treatment for herpes.
I recommend it. Very difficult entity to treat. I have no recommendation.
I know.
Okay.
Kind of.
Okay.
That's it?
That's it.
No, okay.
Okay,
thanks.
Hello, you're live.
Yes, my name is Philip.
Yes, Philip.
And
Could you speak up just a little louder, Philip?
Yes, my name's Philip, and I'm gay, and I'm engaged in a rather exotic sort of sexual activity, which is called fist fucking. Now, I have discussed this with my doctor, who is gay, and he maintains that if you're with someone who knows what they're doing, that is basically not a dangerous activity. He says it's less dangerous than using something like a dildo or other such things. And I was wondering what a straight doctor's opinion of such an activity might be, since I've never really had the nerve to discuss it with a straight doctor.
Okay. First of all, we're dealing with emergency room care here.
Right. Well, you see, I have had a couple of friends hurt in fist fucking and have been taken to emergency rooms. Only a couple, though, out of several hundred that I know.
Well, the only thing I can tell you, let me tell you something. I know some people, my fist is pretty small. I went and I shook hands with Muhammad Ali. And my hand was about the size of 2 of his fingers. So all I can say to you is shake hands first. Have a good night. Hello, you're live.
Hi, Efrom.
Can we have the audio up on the speaker just a little bit? Yes, your first name, please.
Pete.
Yes.
I want to ask the doctor there if he ever heard of emergency room dental care.
Emergency room dental care.
That's very difficult. Okay, I know that comes up a whole lot. People get toothaches and they don't have a dentist that they can go to. Most hospitals don't have dentists on call in the emergency room. And I'll be real honest with you, my knowledge of dentistry is minimal. Okay. Now there are some hospitals where they have residencies for oral surgeons, dentists who do after they finish dental school, they do another year or 2 of postgraduate training, and sometimes if you go to a hospital that has those people there, you could be taken care of. Perhaps, I'm not sure.
Yeah, but how expensive would it be?
What does it cost today to go to an emergency room?
Okay, where I am, the basic,
Where are you?
I work in the Metropolitan Hospital.
Oh, you're not going to tell us the name?
No, I really would not.
Okay.
Thank you. I work in a city hospital, and as soon as you register, it's $55. Okay. Now that, of course, is covered by medical insurance. Okay.
So that gives you an idea of what your basic initial costs are going to be.
So understand, I didn't mind telling you that price because people should understand that that's what that. They shouldn't get, be amazed that when they get there, someone's going to say to them that that's what it's going to cost to be seen. Okay? I just want to get that out there.
Okay, thanks a lot.
Okay, have a good night. Hello, you're live.
Oh, yes, my name is Vincent.
Yeah, Vincent.
I'd like to ask you a question first and then the doctor first.
Okay. My name is Efrom.
When is your show on?
Now.
Besides, normally, at what time is it on?
It's from 12 to 1 every Sunday night.
Okay, thank you. And the question I'd like to ask the doctor is this. I just got out of Lenox Hill Hospital. I had the same operation. I had a gallbladder operation. From the conversation you were having with a girl before, I was trying to get an answer that you never got a chance of giving her. And that was, why would they not give me a painkiller? I went to the emergency room at 9 o'clock in the morning. I did not get a painkiller until 7 o'clock at night. And 3 hours later, then I was operated on.
Okay, now I don't want to seem curt now, all right? But I can't give explanations for other people's actions.
Bo, let me ask you something.
I've
been told by other doctors that the reason why they don't give immediate painkillers is because that pain is a symptom that they want to observe. And I think that might be a case that, there's a balance that you got to...
I don't know if it pertains to him because it seems like he had surgery and then he wanted some kind of pain medication and didn't get it. But without a doubt, there are many, many times that the only thing you have to go on is pain, and especially in the abdomen. and we never give a pain med then. And I've seen people being in agony, and for sure it bothers me, you know. You don't want to see anybody hurting, but sometimes it's the only thing you got to go on, and you can't just take that away, because you can't come up with any kind of answer then.
Well, this is a personal feeling. I'd like to know what you feel about it. The whole day I was actually seen by resident doctors, and eventually at 7 o'clock at night I was seen by the head surgeon who eventually operated on me. And right after he seen me, I got the painkiller. Could it be that they were waiting for him to show up?
I really can't answer the question, okay?
All right.
You're asking something we can't deal with.
Okay, thank you very much.
Have a good night. We're getting a lot of interesting calls.
Hello?
Yes, what's your first name?
My name is Delia.
Excuse me?
Delia.
Delia.
Yeah.
Yes.
How do you think of the atom bomb? You say to ask questions, and I'm asking questions.
Well, you asked it. Hello, you're live.
Yeah, doctor. You mentioned you work
What's
for,
your first name?
Steve.
Yes, Steve.
Hi, Efrom. I like your show, by the way.
Thank you.
Do you work in one of the municipal hospitals? I don't want to find out what hospital. I'm just...
Okay. Yeah, I work for one of the municipal hospitals in the city of New York.
Excuse me, how do you feel about the proposed cuts in the city's municipal hospital system?
Oh, well.
What was the question?
He asked why there's cuts in, how do I feel about the cuts in the hospitals? Of course, I don't want to see them cut the money they're going to allocate to the hospital. I think that would be a given. Don't you? Without a doubt, when they cut costs, they're going to cut the monies that are allotted to the emergency rooms, and we now are understaffed and at times don't have the proper equipment.
But what's going to happen? Will the voluntary hospitals be able to pick up the slack, or what's going to happen?
I don't really know.
Well, we're going to have to be paying for all of this in the future. By the way, we have free lines on both our lines on 475-1550 right now. We, as citizens of New York City, have to pay the dues that have gone down over the years now, and it's going to hurt us. Hello, you're live.
Hi.
Hi.
I
What's your
just
first name?
Oh, Kathy.
Yeah, Kathy.
I have a comment for the gentleman who called in about dental insurance.
Yeah.
You know, if you have a dental emergency, there's a 24-hour hotline you can call.
What's the number?
I don't know. It's in the yellow pages under dentist, because I had to call it once. And what happens is an operator answers, and she takes your phone number, and a dentist will get back to you, and you meet the dentist. If it's really an emergency, like I had very bad pain and had to have the first process before root canal done.
I want to
and the guy will
interrupt you
do
for
it.
just 1 second.
Sure.
We have free lines at 475-1550. A lot of people have been trying to get through, and I just want to let people know that we have some free lines right now. So if you want to try and reach us now, you can get in. Go ahead. Continue.
Oh, that was all. Just for that person's information. Anybody else who has dental emergency.
Thank you very much.
You're welcome.
Thank you very much. That. Okay, that one's ready for us. Okay, and now you can call us at 473-5386. We have free lines. Hello, you're live. I was waiting for you.
He visits you every week.
Every week. Yeah, he's one of those guys out there. Seriously, let's get away from the phones for a second while they screen them. We have some free lines. How does it feel being a doctor? In comparison, the relationship, how you see people relate to you. Do you feel that you can get over with anything because you can say you're a doctor? Or do you feel that... I don't understand
what you mean by get over in what...
In other words, I know if I walk down the street and I walk into a bar and people know who I am because they watch the show, I can get whatever I want. Whether it be a table or meet an attractive woman or what have you. Do you kind of get that image up inside of you that you walking around that you can kind of conquer the world because, you have this mystique that people feel about you?
Interesting question.
As a person, as a human being, do you feel superior to other people in terms, not so much superior as a human being, but superior in the way of being able to deal in this world?
Medicine permeates my life for for like the last 9 years now. That I'm always involved, always encompassed. In school was always up front. It was always up front. And in your training, there's so many hours and hours and hours that now when I get some time away...
How did you learn to party so well? No, go ahead. I'm sorry.
It's only been the last 4 months.
Quick learner.
Yes. That's why school came so easily. When I get away from my medicine, I try to not. I don't meet someone and say, "Hello, Dr. Bezosa, nice to meet you." I try not to show my colors right away, because people do. I want people to. I'm a person. I'm just someone who went to school. you know, and trained and studied and learned what I learned.
Yeah.
Just like someone becomes anything, or you know.
Yeah, when I do this, someone asks me, what do you do for a living? Or what do you do, you know?
What do you do?
You know, I host a talk show on television, you know. It sounds really, you know, you don't know which way to go, you know, like, I'm sure you must feel the same way when it comes, what do you do? Well, I'm a doctor. It all of a sudden opens up avenues.
I'm not going to argue with that. Sure, you know, people, you know, you get into a conversation with someone you meet and they say, you know, what you do, you know, I'm a physician. I'm not a doctor. There are 100 million doctors. Everybody's a doctor. Yeah, I'm a physician. People turn on a little bit. People acknowledge
do you like it
your
or
work.
does it bother you?
All depends on where it's coming from them. Yeah, say if I meet a woman or something and we're just chatting, you can perceive people very well. Everybody has that sixth sense about the other human beings they meet in their life. And when you talk to someone, you can perceive, you know, like how I was talking to them, and then they find out what I do, and all of a sudden their whole attitude towards my being changes. I have nothing to, you know, those kind of people I don't have anything to do with.
Hello, you're live.
Hi, this is Maria. I want to get fucked by the doctor.
You want to get fucked by a doctor?
By that doctor.
Well, go to the hospital.
I'm retired.
Hello, you're live.
Yeah, I want to know
What's your first name?
how long does somebody have to stay in emergency before they get into intensive care?
Excuse me, could you people back there be quiet? Yeah, how long? It would, I can answer that question for you. It would depend on the number of people in the room, in the emergency room, and the priority of who they feel needs the care quicker.
Well, I saw somebody terribly neglected while they took care of somebody that was probably a common cold. How many deaths are there in the emergency room? Through neglect.
I understand your experience. A lot of people, a big gripe about emergency rooms is the time, okay? But I really won't make a comment that if there was someone, you know, critically ill, that somebody was just looking at someone with a cold. I won't agree with that, okay? Surely you know, you get to learn after a while. You get to be able to eyeball somebody, and you know the difference between someone who's real sick or who's just, you know, who's just sick.
And sometimes you make mistakes.
Oh, for sure. I never come across that. You know, you're infallible. All right.
Have you become callous to death?
Callous to death?
Am I still on?
You're still on.
Yeah, because I had seen an emergency
One
shooting.
second. I asked the question first. Wait 1 second. I'm not trying to be rude. I'm just trying to be cute. No, seriously. After a while, do you learn to get used to it?
You get a little desensitized. You know, you have to learn, especially if you work in the emergency room, to put it in a certain.
She hung up on me.
Okay.
Go ahead.
To put it in a certain perspective with you, because you work with it all the time. You take it home. You know, if you take it home with you every day. You know, I got to go home with that. You have to have a certain place in you that it works out all right, or else I wouldn't be able to get out of bed in the morning, really.
So you've got to turn it off. You've got to turn it off.
A little bit.
Hello, you're live.
Yes,
what's your first name?
It's Lenny.
Yeah, Lenny.
Listen.
Yeah, I'm listening.
I just heard a young lady call, and she was talking about the dentist, and she mentioned about house call, emergency number. Emergency number in case you need some help on. Right, and I have the number here. I had called the dentist before, and they will come out to you, and they will say about you. But I wanted to ask the doctor something.
Mm-hmm.
That's Dr. Bo.
Dr. Bo?
Yeah, you can go Bo.
Okay, whatever. Just
I was shot one time.
Mm-hmm.
And,
where?
And I'm laying up here on the table now. Is it right for the doctor? Now I know that a doctor have to feel how far that bullet is and so forth and so forth.
Mm-hmm.
But isn't there other ways that they can do it without putting a hand in the wound?
Where were you shot now, sir?
I shot in the side.
You were shot in the thigh.
No, in the side.
In the side.
Yes.
Okay. Could you tell me where? You know, down by your buttocks or up by your armpit? Where in the side?
Up by my armpit.
Okay. Now you got to understand, you had a bullet that might have been a potential chest wound. Okay.
Mm-hmm. Right.
It was very important for those doctors to ascertain how deep that thing went, because it was definitely going to matter how they were going to treat you and how quickly they were going to work on you. Without a doubt, you had the potential of having a fatal gunshot wound. Okay.
So what you're saying that they didn't have time to take me and get an X-ray on that to see where the bullet is lodged in my body.
No, with a chest wound, you kind of work a little more rapidly than you would with something else.
Okay. And another thing, now they had some tubes that they put up in my nose down to my stomach, and he snatched my hair. He just snatched it back. You understand? Of course, you know, I wouldn't let him put the tubes up my nose. You understand? But,
okay, I know that's a very, very uncomfortable thing, but it's very important. You
but one thing about it, I'm alive, and I thank the doctor for it. But it's how the doctor do it. And I was just wondering, how do you go about doing all this and then go home and say, well, I did a hell of a job today?
Okay.
It seemed like you hurting the patient more.
I think what the doctor was trying to do was save your life quickly, and that came first.
Yes, it was.
Okay, have a good night.
Okay.
We got a lot of callers.
Okay.
Hello, you're live.
Yeah, I'd like to know, how do you feel about bondage sex?
I don't feel any way about that.
Hello, you're live. What's first name?
Maria.
Maria?
Yes.
Yes, Maria. You sound very good over the phone, by the way.
Oh.
Go ahead.
I would like to know that one day, if you by yourself and something happened, what would you do?
You dial 911.
How about if you don't have a phone?
If you don't have a phone?
Yes.
I would go to a neighbor.
Or get out in the street or something.
Hello, you're live.
Yes, this question is directed towards Dr. Pazzoza.
Yes.
Yeah, Howie, this
What's
is
your
Ron.
first
How you
name?
doing? I have a question to ask. What do you, I have a two-part question if you don't mind.
Well, let's get one down.
Okay,
I hear a siren in the background. Where are you?
Howie, how do you feel about the level of patient care in the hospital system in emergency rooms now?
The level of patient care. Well, the people I work with happen to have a lot of caring in them, and they work very, very, very hard. Okay, I want you to know that. And they're swamped all the time. I mean, these people are worked to the bone. I mean, it never stops in the ER. It never stops. Do you understand what I'm trying to say?
Yeah, well, working in the emergency room myself, I can relate to that.
And I know that these people are, they've done the training, they've gone into it because they wanted to do these things. I would think they'd only want to deliver the best possible patient care they could, okay? That's how I feel about it.
Okay, I've got something to say to that. Did you ever see the movie MASH?
Yes, I did.
Originally, when the movie opened, you saw doctors working on bodies with blood all over the place, and you really got upset and nervous. But as the movie went on, the same situation was there, but you became a little bit more callous to it, and they dealt and you dealt with the movie. You know what I'm saying?
Yeah, I can.
And you may be feeling the desensitized doctor there, but in reality, they're doing their job.
No, I understand that. But the question I was asking was realizing the city's financial condition and realizing that there
You've got to do it quickly. We only have 8
realizing
minutes
that there are imminent cuts in the future. Do you think that the hospital system, especially emergency rooms, because they're particularly affected by this, can survive any cuts of any caliber? I mean, don't you feel that we're already strapped to the bone and cannot possibly bear any future cuts because the level of patient care would not be adequate?
From the minimal amount of politics I know, I feel, similar to that, okay?
Okay, thanks, Al.
Hello, you're live.
Hello.
Hello, what's your first name?
Alan, Efrom. Hello, how are you?
Hey, this is Efrom Allen. How are you, Alan?
Okay, and I want to say hello to Sarah, too.
Sarah's there?
Hello, and I have a question for the doctor.
Yeah.
Okay, Doc, this is it. Given the amount of patients you see each day in the ER room, okay? How do you, this is a personal question, how do you professionally handle your attitude towards each patient? How can you say, going up to a patient, I'm going to take care of this person. It's not just another ill body, but a person, a living person, and I've got to give, I have to get rid of all of my hang-ups and deal with that person. How do you approach that?
Okay.
It's a difficult thing.
Very much so. Okay, especially in my position, I have to establish rapport with another human very quickly because the only way I'm going to ascertain data and get something. Okay? It's always up front. It's always up front in your mind. Keep saying to yourself, this is a human being, this is a human being. You understand what I mean?
Right.
Try not to get callous about it because you are. Sometimes I work like a machine, without a doubt. And I might seem mechanical at times.
Is there any preparation for that kind of thing happening while you're in med school?
I would hope that the admissions people, when they're considering candidates to go into medical school, that would be one of the most important things up front, besides just having basic intelligence. Yeah, sure. You take many interviews.
How can they find a person that is capable of dealing with that kind of pressure?
Well, all they can possibly do is is have a number.
I think to get into med school, there's a great deal of pressure that you have to go through.
There's a number of interviews you have to go through, and you have to go through down the line, and these men who are taking you into school only can judge you. You know, you can only go by judgment.
Very quick.
Okay.
Okay, I got to go on, Alan. We've got about 5 minutes.
So take care.
I wanted to deal with that. Okay.
You want to deal with that?
No, it's all right.
Okay, hello, you're live.
Hello, does the doctor ever piss on his patients?
Yeah, hello, whatever he said. Hello, you're live.
I'd like to ask the doctor, what percentage of people that come
By the way, we have 3 lines on both numbers here if you want to get through.
Yeah, right. What percentage of people that come into the hospital aren't really emergencies?
What percentage of people who come into the ER are not emergency?
I'm going to have to hang up on you and listen to the answer because we've got a bad connection.
All right.
Okay?
I'd say between 60 and 75%. Okay?
Okay.
They could be dealt through other ways, i.e. clinics, you know, private physicians, things like that. There's a lot of things in the emergency room that are not real emergencies.
Okay. Hello, you're live.
Oh, yes, my name is Robert.
Yes, Robert.
I wondered, I've seen a secret on 60 Minutes, and they said that 8 out of 10 doctors is on either drugs or alcoholic. Is that true?
8 out of 10? I think you got your numbers wrong, sir.
It's on 60 Minutes, so about 3 weeks ago, they had a secret on...
I don't agree with 80% of the physicians being on drugs or alcohol, period.
Okay. You're welcome. Hello, you're live.
Yeah, I'd like to know, how is it that I'm sorry, my name's Jeff.
Go ahead, we only got 2 minutes.
How can the present medical profession...
We couldn't even raffle you off tonight. These are good questions.
...rationalize keeping doctors on emergency room shift 24 to 36 hours, non-stop, and then maybe letting them sleep a little bit and then put them on again? How can a patient be receiving optimum...
Okay, we've got your question. I'm gonna disconnect you and listen to the answer, okay?
Okay. Very interesting question, and without a doubt, something that's been on in medicine for all the years. How do doctors work efficiently after being on for 30 hours?
They take drugs, no.
You don't take drugs, okay? You get conditioned, and you're tired, and you learn how to catnap, and you learn how to get a little bit of rest here and there, and you try to do the best you can. That's all that's ever asked. It has to be that way because there are not enough funds, okay, right now, and those men have to be on, or the places wouldn't be covered with physicians.
Hello, you're live.
Susan.
I can't hear you.
Hello, my name is Susan.
Yes, Susan.
I want to know if Dr. Bezosa has enough time during his day to follow through his patients once they get admitted into the hospital, whether he's interested or whether he has the time.
Okay, I'm going to disconnect you again and listen for the answer. We only have 2 minutes left.
Okay.
Very good question. The nature of my specialty, the nature of emergency medicine, is to basically be one-shot medicine. Okay, but for me,
it's like a mash unit.
Yeah, I enjoy the follow-up because I have to find out if I was right or wrong sometimes. So when something comes down and I'm not really sure, patient gets admitted, and I try to follow up in a day or two, see what happened. Okay?
Hello, you're live.
Oh yeah, I'd like to know how can a patient tell from a blow to the head if it is severe enough to go to the emergency ward?
Okay, good question. Hold on. I'm going to disconnect you again. Okay? Listen for the answer. Go ahead.
Okay. I'm going to be categorical. I think most head injuries should be seen by a physician. But some things that I use for severity of head injuries would be loss of consciousness for sure. All right, blurring of vision, if the patient starts vomiting, things like that. Those are very serious. Okay, without doubt, go to the emergency room.
Let me ask you something. We only have about 2 minutes left to the show here, and we have more callers that we may be able to get to. Is there anything that you would want to tell the viewers that they should look out for, things that they should immediately run to the emergency room for, that they may overlook, or may, I don't know.
That's very difficult.
We're dealing with medicine here, and people who are going for emergency care, when should they not dawdle and, if they're bleeding or whatever, when should they really